Good morning. This is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida's College of Public Health, and I've been getting a lot of questions from friends and family recently on how to make sense of all of the COVID-19 data, specifically in Florida. And so, first, a big disclaimer, this is very much an unpolished video. There's no editing done. I'm just kind of speaking off the cuff about some of these issues. But I want to share with you, first, answer a few questions that I've received more recently, and then show you how I've decided to package this information so that it might be a little bit more accessible to understand what's going on in the state of Florida related to COVID-19. First, all of the data that I'll be interacting with is publicly available data. I actually went to this website on the Florida Department of Health and downloaded information. This is updated on a daily basis, and so the information that I'll be discussing with you was current as of yesterday, June 16th. Another question that I've received as of late is, why is there a difference? So if you go to Florida's dashboard and look at the epidemic curve, or the number of cases of COVID-19 each day, and you actually compare that on a day-to-day basis, and yes, people do this, with what, let's say, the New York Times or Johns Hopkins University's dashboard is presenting, you're going to see some subtle differences in that reporting, specifically for deaths. And so I just wanted to tackle what I believe the reason for that is. If I look, for example, at the number of deaths in the last 30 days as reported in Florida, versus what the New York Times has reported in the last 30 days, again, you're just going to see differences. And so the reason for that is the New York Times and Johns Hopkins is basically taking information that Florida reports on a daily basis. So right now, here's our current total of deaths associated with COVID-19. And so the difference is those deaths, we may have just learned about a death yesterday, but the death actually occurred almost 2 weeks ago. There is a delay in reporting of deaths. And so again, whereas the New York Times and Johns Hopkins is going to talk about, well, here's how many cases or deaths associated with COVID-19 that Florida has reported on a daily basis, what you'll find on Florida's website is that same kind of curve over time, but based on the actual date of death, not when we found out about the death. So a little bit more accurate. I just wanted to tackle that before we get into anything else. And the last thing I'll say is Florida actually provides some very detailed reports on COVID-19 on a daily basis. All of these are downloads, and again, this is yesterday's report. And this is a PDF that is, you can see, almost 1,400 pages. They talk about testing and characteristics of cases using even more granular data, obviously, than I can download publicly, so they can drill down a little deeper. They also provide detailed information on every single death. They provide information on every single case. And so that's why this report ends up being about 1,400 pages and is growing on a daily basis. So I just wanted to cover a few of those things before we dive into the data. So I'd love your feedback on this. This is something that I'm going to make publicly available on a website. And again, that's because it's using publicly available information. So the first visualization is your, again, traditional epidemic curve. And this is the number of cases by day. You can hover over any of the days and get some information. So for example, on June 15th, there were 2,776 cases. And then it also gives you the total cumulative number of cases, right? So there were 77,739 in Florida. This is among those people who have been identified as Florida residents. As you can imagine, COVID-19 also happens to people who happen to be in Florida, but who are not residents of the state. And so you've heard some discrepancies, I imagine, about the numbers, right? Are we being fully comprehensive on Florida's dashboard in terms of reporting the true total numbers, including Florida residents and those people who may not be residents? And so you can find that information on Florida's dashboard. On this visualization, you can toggle back and forth between including non-residents. The numbers go up just a little bit. So now we have 2,825 among all people in Florida. And again, if you wanted to restrict this analysis to just Florida residents, you can click off of that and it goes down a little bit. I've also put some key dates of interest. So when Florida started opening up in phase one, the extended phase one reopening that spanned throughout the state, including all counties, the beginning of the George Floyd protests, because certainly people were starting to accumulate in numbers and not practice social distancing. And although a lot of them were wearing masks, again, I think, this is a critical date in terms of possible spread of the virus. And then, of course, the recent phase two reopening, just kind of putting some markers in here so you can gain some context. And then the red line, what it does, since these case counts bounce around on a daily basis, I provided this line, which for each date, what I did was I calculated the average number of cases on that day and the previous 6 days. So it's kind of like a 7-day moving average over time. And again, that just shows you kind of the true underlying trend of cases over time. And obviously, we're in a sort of unprecedented increase in cases in Florida. I won't get into whether that's a second wave or just an increase that's associated with the first wave itself, but obviously we've had an uptick recently. Another thing that I've tried to do in this visualization is you can drill down to any county of interest. So I'm going to pick Hillsborough County because that's where I reside. And again, look at that same curve in Hillsborough County. Obviously, the total case counts are lower than the state, but you can see that same trend where we had a blip in early April, stayed pretty flat until the end of May and the beginning of June, and now we're starting to see a more pronounced increase. So again, you can drill down to any county that you'd like to. And then, of course, something that's interesting to me, since I am a maternal and child health epidemiologist, is information by age. So if you were, let's say, interested in the epidemic curve just among individuals who are 65 and older, again, this is something that I did in another video. You see that increase in April starts to trend downward, and then you start to see an increase in June, but we're only reaching levels that were pretty consistent with early April. Compare that to, let's say, the 20 to 34-year-old age group, and again, you see that small increase in early April, and we're really seeing some market increases in this particular age group. And so again, you can drill down to any age group of interest using this visualization. So next, in addition to looking at information, just kind of what's happening on a daily basis, it's also good to just kind of see an aggregate. How are the cases growing over time? So this is that same information with the same key date markings, and all this is just the total number of cases, right? So again, as of June 15th, there were 2,776 new cases reported on this day for a total of 77,739. So again, this is just talking about on a daily basis, what do our cumulative numbers look like? And again, you can filter to any county of interest or any age group that you might be interested in. And again, toggling the, do I just want to look at Florida residents or everybody in Florida that we've had documentation of COVID-19. This is an interesting visualization that, there's not a lot of toggling going on here. You just kind of take it for what it is. Each line corresponds to a different age group. And so again, we're looking at the 7-day moving averages in terms of total case counts. And just to get an idea for all cases, not only how is it trending over time, kind of the shape of each curve, but the relative number. So, this top purple line is associated with individuals who are 35 to 64 years of age. And obviously the case counts are much higher than, let's say, some of these data for the 15 to 19-year-old age group. But you can still see in this age group, if you follow the red line, that in early June, now we're starting to see, even though the numbers are lower, a marked increase in the number of cases that have been reported. And again, I'm not right now getting into the why behind that. It's almost certainly a combination of more comprehensive testing, more people that are getting tested, as well as the relaxation of the mitigation strategies that we've been implementing. The next visualization this is just of interest to me. I was curious how the cases laid out in terms of 3 major age groups. So again, this is number of cases per day, your epidemic curve. But I've tried to put people into a reasonable number of age groups. So the pediatric population, 19 and under, the elderly population, 65 and older, and then the kind of working age population, everybody in the middle. And again, just looking at the proportionate distribution by age. So, for example, if I hover over this bar on June 15th, the working age population made up 75% of cases on this particular day. The elderly made up 12.9% of cases on this day, and the pediatric population 12.2% of cases on this day. So again, just to get an idea of how the age distribution changes over time. This is, although the labels kind of end up overlapping here, this is just giving you among all cases currently, right? So on the most current day that we have aggregate information, what proportion of all COVID-19 cases resulted in a death. So, in this case, it's 3.8% of those individuals that we've identified in Florida have actually died from COVID-19. This is telling us the proportion that ended up being hospitalized. So 15.6% of all cases. And a big important thing is there's 23% of cases right now that we don't know. We have unknown, it's missing information. Emergency department visits, so 23, almost 1/4 of all COVID-19 cases had an emergency department visit associated with it. And then when I try and actually classify each COVID-19 case that we know about now into one of 4 mutually exclusive groups, what I end up coming up with is there are 3.8% of COVID-19 cases that resulted in death. There are 12.6% of all COVID-19 cases right now that did not result in death, but did result in hospitalization. There are 10% of COVID-19 cases that did not result in death or hospitalization, but did result in an emergency department visit. And then you have about 73.5% of all COVID-19 cases in Florida right now that we just know that they tested positive. They did not result in an emergency department visit, a hospitalization, or a death based on the information we have right now. And again, we're constantly getting updated information on cases, so these proportions may change, but just interesting to see how they lay out. Most people who are a case in Florida have not had, death, hospitalization, or emergency department visit. This is now just, again, I'm always interested in the age distribution. This is not something that would be surprising based on what we know about the virus, but if you looked at just the age distribution among all COVID-19 cases in Florida, this is kind of how it lays out. Again, less common in the pediatric population, but certainly, also not non-existent. It's most common in the working age population, kind of the 20 to 34-year-old age group, and then the 35 to 64-year-old age group. And then, of course, it's also very common in the elderly population as well. If you look at that same age distribution among COVID-19 cases that resulted in death, obviously now we see a shift in the age distribution towards the elderly population. Again, this is something that would be expected. And then I also present some visualizations for cases resulting in hospitalization and cases that resulted in an emergency department visit. And so again, just kind of comparatively looking at the numbers. And again, if I were to hone in on any of these, let's say it's this age group right here, the 35 to 64-year-old age group, they make up a pretty large proportion of all COVID-19 cases, a slightly smaller proportion of those cases that resulted in death, a pretty pronounced proportion of those that resulted in hospitalization and emergency department visit. And again, hovering over any one of these groups will highlight that group in the visualization so you can kind of compare, relatively speaking, what proportion of all cases in any particular group that this age group comprised. Then we've got case type by age. So again, this is pretty granular information, but again, I just wanted to see, and this is nothing new here, right? The take-home message of all of this is, I guess, best exemplified by this visualization. So I'm hovering over the red bar. This is the proportion. So the x-axis here is the actual single year age group, right? So this is telling you the proportion of all cases for a particular age group or a single year age that resulted in death, right? And so we can see as we go from left to right, as we get older, the proportion of all cases that ended up resulting in death increases, right? Again, nothing that's surprising here. But again, just to see how all of these distributions kind of lay out by single year age groups is something that might be of interest to people. This next visualization is all about this is at the county level. So each bubble or circle on this graph is associated with a county. And so what I did was I took the average age among cases in that county. That's on the x-axis here. So we're getting older as we go from left to right. And then the case fatality proportion or case fatality rate in that county. So of all of the cases that we know of in that county, what proportion of those cases resulted in death? And so clearly what I'm trying to demonstrate here is that as the average age in a county increases, that is at least one potential explanation for why we see variation in case fatality rate. So if people tend to be older on average, or the cases who get COVID-19 tend to be older on average in that county, the case fatality proportion is going to increase. The size of each circle is proportionate to the size of the number of cases. So for example, we have the most cases in Florida in Miami-Dade County, and so that's why this circle is the biggest. And so by hovering over it, I know the total number of cases in Miami-Dade, the total number of deaths among those cases. In this case, that's 3.8% of all cases that have died. And the average age of cases in Miami-Dade County is 48.7 years. If we compare that to, let's say, one of the extremes up here, this is Charlotte County. So Charlotte County has one of the highest case fatality rates in the state of Florida. In fact, I think that it is the highest. So 13.4% of all COVID-19 cases in Charlotte County have resulted in death, or 73 of 543 cases that we know about. But it's also, on average, has one of the oldest average ages among cases at 61.8%. So anyway, that's just some basic information on how age is associated, obviously, with the likelihood of death among COVID-19 cases. I've also included a couple of maps here because I'm a very visual person. This is a very simple map that's just demonstrated, again, the size of each of these circles is associated with the sheer volume of cases in a particular county. Obviously, more populated counties are going to be associated with bigger circles because there's more people at risk of getting the virus. And the cool thing about this is hovering over any circle gives you actually a lot of granular information. So I'm going to take just a second to go over what these tooltips will show you. So in this case, this is for Hillsborough County. It gives you the estimated population in Hillsborough County, gives you the total number of cases, 3,967. The case rate per thousand, so of every 1,000 people in Hillsborough County, 2.9 of them have currently been identified with COVID-19. There are certainly more that just haven't been tested and are asymptomatic. Of those 3,967 cases, 103 have resulted in death. That is a death rate per thousand. So of every 100,000 people in Hillsborough County, 7.5 have died from COVID-19. And then the case fatality rate, again, that's of all of the cases of COVID-19, what proportion have died, that's 2.6%. And then I give some basic information on the number of hospitalizations, the number of emergency department visits, and then I try and give you some things that are a little bit more easy to understand. So there is currently one case in every 348 people in Hillsborough County. Right. Again, it's most assuredly many more than that, and due to the lack of completely comprehensive testing, we're not able to identify every person who's been infected with the virus. But again, based on the information that has been reported as of yesterday, one case in every 348 people. There's currently one death associated with COVID-19 in every 13,387 people in Hillsborough County. There's currently one COVID-19 related hospitalization in every 2,539 people, and there's currently one COVID-19 associated emergency department visit in every 1,798 people. And then there is currently one death for every 39 cases that we know about. So again, translating that case fatality rate into something that, again, to me is maybe a little bit more interpretable, that again, of every 39 cases that we have, we see one death. Then we see that same kind of information that I just went over just in different maps. So this is what they would call a chloropleth map, or a map that's just got some colors that is shaded to indicate something. In this case, it's indicating kind of the rate of COVID-19. So the previous map showed circles that are proportionate to the number of cases. This is now kind of, adjusting for the differences in the population in each of these counties. So the way that the shading goes is a deep red means that 1 in every 50 people in that county have been identified with COVID-19. So let's see if I hovered over. So right here, this is Liberty County. Only one case in every 38 people in Liberty County. Again, Liberty County is very small, but again, the rate at which we're seeing COVID-19 detected in this county is pretty high. Again, there are more than 1 in 50 people in the county that actually have COVID-19. The deeper orange is 1 in every 100. The lighter orange is 1 in every 200. The yellow color is 1 in every 500, and the green is less than 1 in every 500. And again, there are a lot of factors that contribute to these rates. Certainly the comprehensiveness of testing, the age distribution in that county, social mitigation strategy. I mean, all of those things go in, and this certainly doesn't drill down to the why behind this, but does give you some useful information, I think. And then the last map that I have is all about now doing that same chloroplet, that color shading, but based on the case fatality. So again, the red is 1 in every 10 people, 1 or more, right? And every 10 people that we know have COVID-19 have died. And so if I hover over Charlotte County again, we're looking at that 13.5% of individuals have died. That's 1 in every 7 cases of COVID-19 result in death. As I alluded to earlier, Charlotte also has one of the more elderly populations, and so among the people that we've identified with COVID-19, they tend to be older on average. And then again, this shading just corresponds. The more yellowish you get, the lower is the case fatality. The more red or orangey that you get, the higher is the case fatality. Those counties that are shaded in gray are those that have resulted in fewer than 5 total deaths due to COVID-19. 2 more things that I presented here. This is just simple information in a tabular format. You find the same information on the Department of Health's website, but there's, again, a lot of this discussion as to should we be presenting information for Florida residents only or to include non-residents. So I've given both here in terms of the number of COVID-19 cases, the number of deaths among those cases, hospitalizations among those cases, and emergency department visits among those cases, stratified by Florida resident status. And last but not least, a very busy table, but with, again, what I think is good information. This is initially sorted in descending order based on the number of cases. So Miami-Dade is at the top because they've had the most cases in terms of volume for COVID-19. And then it just gives you, again, so I'm just going to use Miami-Dade as our example since it's at the top of this. There are 22,301 cases that have been identified in Miami-Dade. That is 1 case in every 122 people. There have been 5,611 emergency department visits, or 1 ED visit in every 484 people. You kind of get the trend here. I do the same thing for the hospitalizations. I do the same thing for COVID-19 deaths. Again, in this case, there are 847 deaths due to COVID-19 in Miami-Dade. That's 1 death in every 3,206 people in the county. And 3.8% of all people with COVID-19 in Miami-Dade County have died. This is the total number of cases per 100,000 people. So again, for every 100,000 people in Miami-Dade County, 821 of them have COVID-19. Again, just a different way of thinking about the numbers. The average age of cases in Miami-Dade is 48.8, almost 49 years. And then this was just the estimated population in Miami-Dade County. And again, I can toggle this information. If I just click on Florida non-resident as well, it will update all of the information in this table. If I remove Florida residents and just look at non-residents, again, it'll update the information in this table. With all that good information. So anyway, that was a little bit longer video than I had planned on, but I wanted to work through these visualizations that I'm trying to make available. Again, this is more about just giving the information based on the information I can get my hands on at a granular enough level to present some useful info. Obviously, all of these data need a lot of context, more information, more testing, case positivity rates, a lot of other information that I couldn't get my hands on. But I hope that this at least helps those individuals who are interested to digest these data. This is not part of my daily job. I'm doing this kind of just on the side at night, but I will try and keep this information up to date as much as possible. But thanks for listening.